For more on the factors driving these trends, I spoke with Dr. Suzanne Petroni. She's from the International Center for Research on Women. She's Senior Director of Gender, Population, and Development there.
There are a lot of things that have led to the decline, increases in skilled assistants, a lot of international attention and funding as a result of the Millennium Development Goals has gone to countries that are hit hardest by maternal mortality to improve the quality of care, improve training of providers. But there's so much more that needs to be done. In many of these countries, it's the poorest of the poor, the rural villages where you see the highest rates of maternal mortality. And the women don't have the financial resources to get to the hospitals. They don't have the support in many cases of their husbands to go and get health care. They have other burdens on them. They have to take care of existing families, so they don't get the health care that they need prior to giving birth. So those are the types of things, some of these gender norms that are driving women to stay at home, some of the financial considerations that are prohibiting them from accessing services that we need to overcome.
One of the quotes I also lifted was, education provides them with the knowledge to challenge traditional practices that endanger them and their children. Is that still a major problem?
Absolutely. We know that because of the Millennium Development Goals and the increased attention to girls' education over the past 15 years, we have seen significant strides in terms of girls' primary school education. Secondary school and beyond is still a huge challenge. And there are so many factors that are associated with lack of education for girls. One of them is early pregnancy and early marriage. That's the second one. Girls who are out of school are much more likely to be pregnant early and child brides. And we know that there are 15 million girls who are married each year under the age of 18. We know that girls who are younger are much more likely to see maternal health problems. They have earlier childbearing, they have more children over a lifetime, and both of these contribute to increased maternal mortality and morbidity.
Sub-Saharan Africa is still a major problem. There has been improvement in Eastern Asia. Can you talk to me about the glass half empty, glass half full? Why are we seeing improvement in one area? Why a continuing struggle in Sub-Saharan Africa?
So one of the things that this UN report came out with is that about half of the maternal deaths we're seeing are in fragile states. So states that are seeing conflict or natural disasters where it's much harder for women to access health care. And we're seeing much more of that happening in Sub-Saharan Africa than in East Asia. Another thing that we're seeing is, again, this close association with poverty and with gender inequality.
Is there a country you look at where you've seen significant strides that can be a beacon of hope, that could almost be a model?
Iran. Many years ago, the government got together with the imams and recognized that women were having too many children, more than they wanted in their lifetimes, and that offering them access to family planning free of charge could help them to have the number of children they want. And you've seen resulting increases in contraceptive use and decreases in maternal mortality.